Representative Johnson.
Yeah, thank you. And as you can see, and I apologize, I don't mean to get heated, but I am desperately aware of why we need this legislation and that it needs to pass and that it is important for our healthcare community and for protecting and saving women's lives. I don't, just as you said, Jennifer, we don't want this hijacked. And I appreciate what y'all have said about the intent. But to make sure that this doesn't get derailed or taken off track about the discussion of 1925 law, to make it clear, because you said there's other bills working their way through that's a debate. Would you guys be willing to support an amendment on this bill to make it clear that this is not attempting to revive the 1925 so that there's no question it's put to bed?
Like I said, this is a negotiated bill. We're currently negotiating amendments, and that's one of them.
And so you would support making this clear this is just medical exceptions and not attempted to revive 1925. And I appreciate that because that's so important to make sure this thing goes through the right way.
I want to be careful. There are several amendments in negotiations. I don't want to interrupt that conversation.
Okay. How about for the rest of you from the other organizations, since you're such an important stakeholder, would you equally agree that an amendment to make it clear that the language is clear, this is not any attempt to revive the 1925 or other components of it is not what we're doing here?
We have to see the language of the amendment, but it is not our intent to do that, and we would not object to an amendment that is agreeable to all parties that ensures that this is not about the 1925 law, or an amendment that says there's no intent to prosecute a woman seeking an abortion. The bishops have never supported the prosecution of women seeking abortions.
Yeah, and when we say that, because it then takes us to grandmother and everything else, and those are other bills being debated, and that's why I want to make sure, is there a commitment from you all that we're not trying to bootstrap that other argument? We're really trying to focus on the medical community, and that's why I'm asking about that.
And I think this bill narrowly does, so that's why we're so careful about amendments, is we don't want to open up those other debates and other conversations for another day. It's a rare opportunity to have a common ground abortion bill, and we want to protect that.
Representative, in our view, this bill does nothing to, and we would oppose it if it created any way to prosecute women on whom abortions are performed or who self-abort.
And I appreciate that, but as you can tell, the other side is equally going to that takes us off in another discussion. My question is it possible that, would you be willing to agree to a language that would make it clear that this particular statute and the provisions that are being changed are purely for medical exception and not intended to revive 1925 law in total?
Yeah, I don't know what you mean by revive, but
that's the whole debate, right?
Just do any more than it does. Then it doesn't do anything to that law than it is currently is in effect. Yes, that's our intent.
I appreciate the willingness to talk about that. Thank you, Chairman.